Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our COVID conversations today for September 8th, 2022. We've been doing these for a year now, and we've had some incredibly interesting guests. Today we have Jeanne Wright, who's the Director of Senior Services for Douglas County, and we're going to be talking a little bit today about emergency preparedness for our seniors. Always a great time to get questions answered. So if you do have those questions, please send them to us at Facebook questions at DouglasPublicHealthNetwork.org. Pretty long, but if you send us those questions, we'll get those questions and answer them on the next week's show. We have one good question, which we're going to deal with a little later today. I am very happy to announce that the word on COVID is almost uniformly good. In the world, cases are dropping. There's no new real hotspots in the world. In the U.S., cases are dropping. There's no real hotspots in the U.S. Well, there's a little bit of increased heat in Kentucky and Mississippi, but really no big hotspots in the U.S. Oregon is very quiet, and Douglas County is similarly quite quiet. We're down to less than about 20 cases a day that we know of. I'm sure there are a few more that we don't know of. And we were down to 4 hospitalizations today, only 2, I think, for COVID, 2 for people with COVID. So we're at a low point in hospitalizations. We're at a low point in disease. And the other good news for nerds like me is that I'm always following what variants are out there. And pretty much until this spring, there was always a new nasty variant out there just waiting and lurking to come to the U.S. But since May of this year, there's not really any new nasty variants. And that is a good sign because many people have already had Omicron and there's a new booster. And so if indeed no new nasty variants develop, this could really be the ending of this pandemic, moving us more into an endemic phase. And that's the question. What's the difference between epidemic and pandemic? Well, epidemics are times when the disease is causing havoc, lots of disruption. There's a high amount of disease, a high amount of morbidity and mortality, and it's not predictable where it's going next. So I think clearly in the beginning, this was a pandemic, which is an epidemic in many areas. And so I think it rightly was called pandemic back in March of 2020. And it's been pretty much a pandemic since then. However, if we get to a point where we're down to 2 or 3 hospitalizations a day, 10 cases, a vaccine, COVID booster that's very effective, we really will be out of the epidemic phase. I don't think we're going to eliminate the disease. There are enough small variants in the disease that's likely to continue. And the immunity against respiratory virus is not great. So because the immunity is not great, you can get these again and again. Now, that's very different from other diseases like measles, which you get once and get over. Respiratory disease, you just don't have quite as good immunity, and you can get them again and again. And that's why we get colds again, and that's why we get flu year after year, and why I think we'll get coronavirus again and again. But if we had very few hospitalizations, not a lot of disruption, very few deaths, then there would be much less of an issue. Now, we're continuing to see some deaths, but again, those deaths are almost all in people who are not vaccinated and never had the disease before. So their immune system has never seen this SARS-CoV-2 virus. And when they get it, they get pretty sick. And they've made up almost all of our deaths over the last 3 months. So again, the plea is that if you're not vaccinated, please get vaccinated and get a booster, which brings us to boosters. So there's a new booster out there. It's called the bivalent booster. Bivalent meaning that it has 2 forms of the German. It has the ancestral form and has the Omicron form. There's one made by Pfizer, one made by Moderna. Both seem to be quite effective, at least in early laboratory studies, although they do not have big human studies on these. And the hope is that if you got one of these booster shots, you'd now have great immunity against the Omicron strain, and really not need to worry much about severe disease or hospitalization from COVID. The good news on the booster is it's just arrived. First doses arrived in Douglas County today, and we're going to be distributing them tomorrow. So they should be around in pharmacies and in clinics. In addition, there are going to be some large drive-through events in Douglas County, one in Reedsport and one in Roseburg. The exact details are coming later this afternoon, but as soon as we know those, we're going to go ahead and publish those. We think the side effects from the vaccine are going to be mild, as they were with the previous disease. There's nothing to think the side effects are going to be notably different than before. So again, good news on the COVID front. No new variants out there, a declining amount of disease, and what we hope is a very effective booster. So our word is that everybody 12 and above should get a booster, and they should be widely available. They're still free, so please go ahead and do it. The second thing that we're talking about in public health is flu. So as you know, influenza is mostly a wintertime disease. And so right now, as we're getting to the end of our summer, Australia is getting over their winter, and they had a bad winter of flu. And when they have a bad winter of flu, it means that our winter is likely to be bad for flu. And this is not surprising. Remember, we don't get great immunity to respiratory viruses. And over the last 3 years, we've had very little flu. So people have not had their immunity boosted to flu. And people were busy, lots of things going on, and not as many people got flu boosters. So we think the immunity in the population is low. And if this new flu germ hits the U.S., where we could have a bad flu season. So our recommendation is get a booster for COVID and get a booster for flu. Two other quick things. Monkeypox seems to be quieting down. Still no cases in Douglas County, but about 170 cases in the state. One death associated with monkeypox in a different state. So we worry about monkeypox. We do have a vaccine widely available. So if you think you're at moderate or high risk, and that would be especially men who have sex with men, or people who live in a family of men who have sex with men, should go ahead and get one of those vaccines. And if you do need one of those vaccines, give us a call at Public Health. And then the last is E. coli. We've seen a little uptick in cases in E. coli in August, none yet in September, which is good. Some of those cases attended to FAIR, so there may be some connection there. But again, if you have diarrhea, especially if you have bloody diarrhea, please go ahead and get yourself tested for that. So that's what we have for infectious disease. But public health does a lot more than just infectious disease. One of the things we also do is emergency preparedness. And with us today is Jeanne Wright from Douglas County Senior Services. And we have taken as one of the foci of our program is to work with seniors in their emergency preparedness. So as we looked at this, we looked at the data of who seems to be disproportionately affected by emergencies. And I was rather surprised to see that when I looked at the deaths from Katrina or the deaths from the Paradise Fire in California, that terrible fire down there, half of the people were over 70. Half of the people who died were over 70. Yet only about 12% of the population is over 70. So 12% of the population making up 50% of the deaths suggests that seniors are really high risk from that. And when we looked at the reasons, it appeared that seniors may be less mobile, so less able to flee. They may be less likely to own a car and thus less likely to flee in their car. The third is that they may have some medical issues or medical equipment that makes it hard to travel. If you need an oxygen concentrator or something else that may be hard to move. And then the last is that many of the seniors did not want to go on buses to evacuate from Katrina because they did not want to leave their companion animals or pets. And so we recognize that seniors are at considerable risk from disasters, and the two big disasters we look at here are going to be earthquake and fire. So we're putting together kits to work with the seniors. So Jeanne, thanks for joining us.
Thank you. Thank you for having me on your show today.
So I think you've been working mostly with Teresa Muschler about putting together kits for seniors. Can you tell us a little bit about those kits and what's in them?
Yes, we have been working together. Douglas Public Health Network has been working hard to create some materials specifically for older adults, and really to look at making these larger prints so they're easy to read, information that's pertinent to them what their specific needs. And so we're excited about that. We're also getting some starter things for a kit that we're going to be able to add in there. Just some of the essential things that you need when you're looking at preparing for an emergency, such as what we're facing. So they're going to be doing presentations out in the dining sites. We're going to be looking at information getting out to Meals on Wheels clients, folks that really need this information. And so we're excited about this. This is great. It's the first time we've ever been able to provide a starter kit for folks to be able to add to that kit.
So this is great. What we ask is that everyone make a plan for how they would survive 3 or 7 days should there be a big disaster. And many of us have tried to do that, but it's not easy. I mean, to store enough water is hard. Many people, especially low-income people, don't have the extra money to have a week's worth of food in the house. And many people are on medications, and they buy the medications at the last day so they don't have to put out the money, and thus would not have 7 days worth of medications around. So we're really trying to get this emergency preparedness. Now, who knows when the disaster is going to come, right? It may not come in our lifetime, and thus this preparation would be for naught. But given the increasing pace of wildfires and wildfire smoke, we think this is an important area to deal with. So what kind of things specifically are in the kits?
So we're looking at information to kind of help get people set of what they would actually need. And we will be looking at some basic information. We will have some shelf-stable food in there as well to help out with that. It's going to have such as the emergency blankets that you need in an emergency. It's going to come in a really nice, it's a backpack so that it's grab and go in case you have to leave your home. Or also we're looking at a color that's more brightly so that you recognize either orange or red color that we're looking at. And it will also have great information about, if you wear glasses, have another set of glasses that your older set that would be able to be put in there. Or also it's important too to get your pet ready. So things for your pet that they may need, to have those in that kit as well. And then lots of information about with some handy things like something you can post. It will be a sign that whether you're okay or whether you need help, you can post it on your door. There's just a valuable information such as a place to put all of your contact information, the things that you don't necessarily have on hand. It could be your emergency contacts. It could be your doctor's phone numbers, your home insurance, your just a multitude of important information. You keep it with you so that you have it as you leave and need it for later.
Well, that's all great stuff. So what great work that you're doing over there with the people at DPHN. So we're very proud of that. The other thing we're going to be working on in the next bit is neighbors looking out for neighbors. We know that in a disaster that it does not hit evenly in a community. So in the Paradise Fire, there were places that were totally untouched, amazingly enough, the Dutch brothers, and then other places around it that were just burned right to the ground. And thus neighbors looking out for neighbors is really important. I mean, when we look at the devastation of the fires up the Umpqua or up the Mackenzie, what is truly remarkable is that there are houses that are burned absolutely to the foundation. It is hard for me to believe that fire would be hot enough to melt your stove. I mean, think of how hot that needs to be. But then 100 yards away, a house completely untouched. So during disasters like this, we really need to have neighbors looking out for neighbors, and that's going to be one of our themes over this next year. Well, Jeanne, thanks for joining us today. I'm really looking forward to this plan for working with our seniors and working with neighbors looking out for neighbors. And I'm very excited that COVID, it looks like it may be heading away, which would be great. So again, this is Dr. Bob Dannenhoffer, the Public Health Officer, Douglas County. It's September the 8th, 2022. We'll do this again next week. Bye-bye.